Welcome to this week's edition of Neuroscience Updates, covering the latest breakthroughs, brought to you by LucidQuest. Arrowhead has submitted a clinical trial application to New Zealand's regulator to start a placebo-controlled, dose-escalating Phase 1/2A of ARO-MAPT, an RNAi therapy targeting tau, in up to 64 healthy volunteers and up to 48 early Alzheimer's patients with subcutaneous dosing. ARO-MAPT uses a new TRiM delivery system reporting blood-brain barrier penetration and CNS knockdown in preclinical studies. The USPTO has issued a notice of allowance for a US patent covering daily 10 to 45 milligram dose strengths of vidofludimus calcium for progressive multiple sclerosis, including PPMS and SPMS, and other forms, with protection expected into 2041, with potential extension. This strengthens Immunix IP around vidofludimus calcium, also known as IMU-838. The company references positive Phase 2 caliper results. On September 12, 2025, the FDA granted tentative approval for a generic version of Ozanimod, also known as Zeposia, for multiple sclerosis. Synthen will manufacture and supply the generic for Zydus, and first filer status could enable shared 180-day exclusivity at launch. Tentative approval indicates standards are met, but marketing waits on expiry or resolution of brand protections. GE Healthcare announced intent to acquire Icometrix to integrate IcoBrain with GE MRI systems. EcoBrain ARIA is FDA cleared to detect and quantify ARIA-A and ARIA-H tied to anti-amyloid therapies. The plan targets seamless workflow, longitudinal ARIA tracking, and broader neuro-MRI quantification across MS, dementia, epilepsy, stroke, and TBI. IASO Bio will present findings on Eque-cel autoleucel, a fully human anti-BCMA CAR-T known as Eque-cel, for progressive multiple sclerosis, with a poster at ANA and an oral presentation at ECTRIMS. The company characterizes the findings as promising. Sanofi previewed its ECTRIMS 2025 program dated September 10, 2025 in the EU, featuring 14 abstracts including 3 orals. Tolebrutinib subgroup analyses address non-relapsing SPMS and RMS, including PIRA, while Frexalimab updates include a Phase 2 open-label extension and ongoing Phase 3 Frexalt and Frevivav studies. The focus is on disability accumulation and non-depleting anti-CD40L pathway biology, with specific efficacy metrics not in the release. TG Therapeutics outlined its ECTRIMS 2025 agenda for BRIUMVI or Ublituximab. An oral will present 6-year efficacy and safety from the Ultimate 1 and 2 open-label extension. E-posters cover modified dosing from ENHANCE and real-world evidence from the ENABLE Phase 4 study. Abstracts are posted, with full data to come at ECTRIMS. Johnson & Johnson will showcase 21 abstracts across major depressive disorder, treatment-resistant depression, and schizophrenia at Psych Congress 2025, including a head-to-head study of seltorexant versus quetiapine XR in MDD with insomnia, Caplyta post-hoc analyses in anxious distress, and Spravato monotherapy post-hocs. Stay ahead in neuroscience research, like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.